Have you ever experienced persistent itching in a specific area of your body and found yourself wondering, is this normal? It might seem like a minor inconvenience, something easy to ignore or attribute to dry skin or seasonal changes. But sometimes, our bodies have a way of communicating with us that goes beyond the obvious. Today, we're diving into an important health topic, understanding why some types of persistent itching, particularly in elderly individuals, could be indicators of serious health issues. By learning to recognize these signs, you could not only improve your health outcomes but also those of your loved ones. Itching, after all, is not just about discomfort. It can be a clue that something deeper is going on inside our bodies. In this video, we'll discuss 3 specific areas where persistent itching in elderly individuals might be signaling more than just skin irritation. We'll uncover what these signals mean, how they relate to our overall health, and the proactive steps you can take to address them. Before we get started, if you find this topic valuable, please consider liking the video, subscribing to our channel, and turning on the notification bell. Your support helps us continue spreading crucial health information for our older generations. Let's jump right into it. 1. The hidden messages of persistent itching. When it comes to health, we often think of symptoms like pain, fever, or fatigue as warning signs. Itching, however, tends to be overlooked. But for individuals over 60, persistent itching can sometimes be an important health warning, especially if it's specific to certain parts of the body. These areas could be signaling conditions that impact lifespan, which makes understanding and addressing them critically important. Itching is a sensation that can stem from multiple causes, anything from dryness to allergies. However, persistent itching that doesn't seem to go away with over-the-counter treatments or traditional remedies could indicate a serious underlying condition, particularly if it appears in specific areas like the armpits, anal region, genital area, or lower legs. Let's begin by understanding why these particular body parts are important indicators and what they might be trying to tell us about our health. The case of Nancy, a wake-up call. To illustrate this point, let's talk about Nancy. At 65 years old, she noticed persistent itching around her body, particularly her armpits and lower legs. That seemed to worsen over time. Initially, Nancy thought it was a minor inconvenience, maybe related to changes in the weather or perhaps her body lotion wasn't working as well as it used to. But as winter set in, the itching became more intense and resistant to lotions and ointments. Nancy also experienced weight loss, which she initially attributed to a change in appetite, but over time became more concerned. After several months of discomfort, she decided to visit her doctor. She underwent a series of medical tests and was shocked to learn that her persistent itching was a symptom of lymphoma, a type of cancer. This diagnosis was unexpected, as she had never considered the possibility that such a seemingly harmless symptom could have such a serious underlying cause. Nancy's experience serves as a powerful reminder. Sometimes the symptoms our bodies exhibit, no matter how small, are worth investigating. Especially when these symptoms persist. They can be more than just minor annoyances. They could be indicators of deeper health concerns that need medical attention. 2. Itchy armpits. More than just dry skin? Our first focus area is armpit itching. It might seem like a common issue, after all. Many people experience itchy armpits at one time or another. The causes can vary, ranging from poor hygiene to allergic reactions to deodorants or clothing. However, if persistent itching in the armpit area continues despite good hygiene and appropriate treatment, it could indicate something deeper, linked to diabetes and skin changes. For elderly individuals, one of the primary health concerns related to persistent armpit itching is diabetes. High blood sugar levels can cause a cascade of physiological changes that impact the skin. When blood sugar levels are poorly managed, it can disrupt the autonomic nervous system and the body's sweat glands, leading to dry skin. The result is decreased sweat and sebum production, causing skin in sensitive areas like the armpits to become extremely dry and prone to itching. People with diabetes might also find themselves in a cycle where increased sweating due to high blood sugar levels results in skin irritation. For those who are overweight or obese, this can be further complicated by the armpits becoming a breeding ground for bacteria and fungi. especially during the warmer months. Persistent itching, combined with moisture and sweat, often creates the perfect environment for infections to develop, compounding discomfort. The emotional toll of persistent itching. Dealing with persistent itching takes a toll not just physically, but emotionally as well. Itching can be relentless, and the constant desire to scratch is exhausting. It might be embarrassing in social settings and can severely impact the quality of life. For those dealing with diabetes, the emotional burden of managing blood sugar levels, medications, diet, and other aspects of the condition is already heavy, and the addition of skin issues can make things even more overwhelming. If you or a loved one is experiencing persistent itching in the armpit area, especially if there is a known diagnosis of diabetes, it's essential to consult with a healthcare professional. Managing blood sugar effectively, maintaining good skin hygiene, and seeking medical advice can help alleviate this symptom and improve overall quality of life. 3. Itching in the anal region. Signs of potential underlying issues. Anal itching is another common yet often misunderstood symptom. Many people shy away from discussing this kind of discomfort, thinking it might be embarrassing or merely a nuisance. However, for elderly individuals, persistent itching in the anal area can signal something more serious, such as issues with anal and rectal health, hemorrhoids, anal fistulas, and cancer. The most common causes of anal itching in older adults include conditions like hemorrhoids, anal fistulas, and in some cases, more serious issues like rectal or anal cancer. Hemorrhoids. These swollen veins in the lower part of the rectum or anus are quite common. Especially as we age, hemorrhoids can lead to itching, particularly if there is ongoing irritation or inflammation. The constant need to scratch can exacerbate the symptoms, leading to bleeding or further complications. Anal fistulas. This condition, characterized by an abnormal connection between the end of the bowel and the skin near the anus, can also cause persistent itching due to the drainage it produces. The discomfort often worsens over time, and ignoring the symptoms can lead to further complications. Rectal and anal cancer. Itching in the anal area can sometimes be an early symptom of rectal or anal cancer, especially when accompanied by other symptoms like bleeding, drastic changes in bowel habits, or severe pain. It's crucial to recognize that anal itching, while often attributed to common causes, can also be a red flag for more serious conditions. Persistent itching that doesn't improve with over-the-counter treatments should always be evaluated by a healthcare provider. Emotional and social impact. Persistent anal itching doesn't only affect physical health, it also takes an emotional toll. The itching may be more intense at night, leading to sleep disruptions, fatigue, and even a sense of helplessness. The fear of scratching in public or being caught in uncomfortable situations can lead to social anxiety, making individuals hesitant to attend social gatherings or even leave the house. If you or someone you care for experiences persistent itching in the anal region, especially if it's accompanied by other worrying symptoms, seeking medical advice is critical. Early intervention can significantly improve health outcomes and relieve the discomfort that affects daily life. 4. Genital itching, common yet complex. Itching in the genital area is something that affects many people, particularly women. It can be caused by a variety of factors, ranging from infections to skin conditions. For elderly individuals, genital itching can sometimes indicate underlying gynecological issues that require medical attention. Vulvitis, vaginitis, and other conditions. Vulvitis is an inflammatory condition that affects the vulva, often caused by an imbalance in vaginal flora. This imbalance can lead to the overgrowth of harmful bacteria or fungi, resulting in redness, swelling, and persistent itching. Vaginitis involves inflammation of the vaginal lining, which can be due to bacterial or fungal infections. This condition often leads to discharge, odor, and itching, which can be very uncomfortable. Other causes, eczema, genital warts, and even scabies can also lead to persistent genital itching. The impact of itching on mental health. Living with persistent genital itching can be both physically and emotionally draining. It affects self-esteem, intimacy, and overall quality of life. For women, it can create barriers in relationships, making them feel less confident or reluctant to engage in intimate moments with their partners. For elderly women, there is also the fear that itching could indicate something more serious, like a sexually transmitted infection. Even if that's unlikely, this fear can create a sense of isolation, making individuals hesitant to speak to their healthcare providers. It's essential to foster open conversations about these symptoms so that timely and effective treatment can be provided. If persistent itching occurs in the genital area, it's important to consult a gynecologist or healthcare provider. A proper diagnosis can help determine the underlying cause and allow for effective treatment, bringing relief to the affected individual. 5. Itching in the lower legs. Signs of hypothyroidism. Itching in the lower legs might not seem like a serious issue at first glance. However, in elderly individuals, it can often be an indicator of hypothyroidism, a condition in which the thyroid gland doesn't produce enough hormones. How hypothyroidism affects the skin. The thyroid gland plays a critical role in regulating the body's metabolism. And when hormone levels are low, the effects are often visible on the skin. The skin becomes dry, rough, and prone to itching, particularly on the lower legs. This dryness can become worse during colder months when the air is less humid, leading to more severe itching and discomfort. The lower legs are particularly vulnerable due to their lower concentration of sebaceous, oil, glands. The skin on the legs can become scaly, cold to the touch, and may even take on a pale or mottled appearance. The itching is often accompanied by a tingling or prickling sensation, making it even more uncomfortable. Recognizing the difference between normal dryness and hypothyroidism-related itching. One of the challenges in identifying hypothyroidism is distinguishing its symptoms from those of normal aging. Many people experience drier skin as they age, but the key difference here is the severity and persistence of the itching. With hypothyroidism, no amount of moisturizer seems to help, and the dryness often becomes worse during colder seasons. If you notice persistent, severe itching on the lower legs that doesn't respond to over-the-counter treatments or is getting progressively worse, it's important to speak with your healthcare provider. Early diagnosis and treatment of hypothyroidism can help manage the symptoms more effectively and improve quality of life. 6. Differentiating types of itching. Insights from Dr. Thompson. In this section, we delve into insights provided by Dr. Thompson, a specialist in dermatology, who categorizes itching into dry itching and damp itching. Understanding these distinctions can help you identify the underlying cause of your symptoms and seek appropriate treatment. Dry itching, common among the elderly. Dry itching characteristics. This type of itching is most common in elderly individuals and is usually caused by the natural aging process. As we age, our skin's ability to retain moisture decreases due to reduced secretion from sweat and sebaceous glands. Environmental factors, cold weather, low humidity, and poor hydration can exacerbate dry itching. The skin often becomes rough, dry, and may even peel, leading to persistent irritation. Damp itching, a sign of underlying health issues. Liver and kidney issues. Damp itching is often linked to dysfunctions in the liver or kidneys. These organs are crucial for detoxifying the body, and when their function is compromised, toxins can accumulate, affecting the skin. Symptoms. Damp itching often leads to skin that appears swollen, rough, or even darkened. It might also result in secondary infections like folliculitis or lymphangitis, which can further worsen the condition and lead to scarring. The danger of scratching, breaking the cycle. While scratching might provide temporary relief, it is far from a solution. Persistent scratching can lead to more damage, resulting in increased redness, raised skin, pigmentation changes, and even infections. To manage itching effectively, it's important to address both the symptom and the underlying cause. Practical steps to alleviate itching. Dr. Thompson emphasizes lifestyle adjustments to manage and reduce itching. Skincare. Moisturize the skin regularly, especially after bathing. Reducing the frequency of bathing during winter can also help retain natural skin oils. Dietary changes. A diet low in high fat, high sugar, and spicy foods can reduce skin irritation. Instead, focus on foods rich in vitamins and minerals that nourish the skin. 7. Preventing itching and managing overall skin health. Now that we've discussed the potential underlying health issues linked to persistent itching, let's look at some proactive steps you can take to prevent it from becoming a major concern. Diet and hydration, the foundation of healthy skin. Balanced diet. A well-balanced diet that includes plenty of fruits, vegetables, and omega-3 fatty acids can improve skin health. Foods rich in antioxidants, such as berries, leafy greens, and nuts, help combat the oxidative stress that can worsen skin conditions. Hydration. Staying hydrated is essential for maintaining skin moisture. Drinking plenty of water ensures that your skin remains supple and reduces the likelihood of dryness and irritation. Skincare routines for seniors. Moisturizing. The key to preventing dry itching is moisturizing regularly. Look for creams that contain ingredients like ceramides, glycerin, or hyaluronic acid. These substances help lock in moisture. Avoid harsh soaps. Harsh soaps and cleansers can strip the skin of its natural oils, leading to dryness. Opt for gentle, fragrance-free cleansers that maintain the skin's natural barrier. Environmental adjustments. Humidifiers. Using a humidifier in your home, particularly during the winter months, can help keep the air moist and prevent skin from becoming excessively dry. Appropriate clothing. Wear loose, breathable clothing made from natural fibers like cotton to avoid skin irritation. Synthetic materials can cause friction, leading to increased itching and discomfort. Consulting healthcare professionals. Persistent itching, especially when not associated with obvious causes, should always prompt a visit to a healthcare professional. Dermatologists can help identify skin-related issues, while endocrinologists or general practitioners can provide guidance on conditions like hypothyroidism or diabetes. Early intervention can make a significant difference in health outcomes, as it did for Nancy. 8. Emotional and psychological impact. Acknowledging the struggle. It's not just about the physical discomfort. Living with persistent itching can impact mental health and emotional well-being. For many, the feeling of constantly needing to scratch can create anxiety, especially in social settings where the behavior might be frowned upon. The social consequences of itching. Persistent itching can make people self-conscious. Imagine being at a dinner party and constantly feeling the urge to scratch. It can be embarrassing and isolating. This anxiety often leads to individuals avoiding social gatherings, resulting in a sense of loneliness and isolation. Building support networks. One of the best ways to manage the emotional burden of itching is through support networks. Whether it's family members, friends, or support groups for individuals with similar conditions, having people to talk to can alleviate some of the emotional stress associated with chronic symptoms. Mindfulness and stress reduction. Mindfulness practices, such as meditation and breathing exercises, can also be helpful. Stress is a known trigger for many skin conditions, and learning how to manage stress effectively can reduce the frequency and severity of itching episodes. Practices like yoga or Tai Chi not only keep the body active but also promote mental relaxation, which is beneficial for overall well-being. 9. Crafting a personalized plan for skin health and longevity. Create a routine that works for you. When it comes to preventing itching and managing skin health, consistency is key. Building a skincare routine that fits your lifestyle and is easy to maintain can significantly reduce the occurrence of skin problems. Steps to take today. Daily moisturizing. Set aside time each day to moisturize, ideally after a bath or shower when the skin is still slightly damp. Stay hydrated. Make drinking water a daily habit. Carry a reusable water bottle with you as a reminder to stay hydrated throughout the day. Mind your diet. Make small adjustments to your diet to include more foods that promote skin health, like omega-3 rich fish, fruits, and vegetables. Seek out community resources. There are also resources available in many communities to support seniors in maintaining their health. Community centers often offer classes in yoga, Tai Chi, or water aerobics, activities that are gentle on the body but have numerous health benefits, including stress reduction and improved skin health. Regular health checkups. Regular checkups are an essential part of maintaining good health, especially as we age. Whether it's visiting a dermatologist for persistent skin issues or having your thyroid checked, these visits can catch potential problems early and lead to better outcomes. Understanding the significance of persistent itching. Itching might seem like a small thing, a minor inconvenience, or just another part of getting older. But as we've discussed today, persistent itching can be an important clue that our bodies are giving us about our health. By paying attention to these signals, consulting healthcare professionals when needed, and making small, consistent changes to our routines, we can significantly improve our quality of life and perhaps even increase our lifespan. Remember, our bodies are always communicating with us. Sometimes, it's a whisper, like a persistent itch, and other times it's a shout. Listening to and understanding these signals can empower us to take control of our health. Thank you for watching today's video. I hope you found this information valuable and insightful. If you've learned something new today, please share it in the comments below. What's one action you're going to take this week to improve your health or the health of a loved one? If you found this content helpful, don't forget to like the video, subscribe to our channel, and hit the bell icon so you never miss our updates. Your support means the world to us, and it helps us continue to bring you important health information. Until next time, remember, your health is in your hands. Stay informed, stay proactive, and stay healthy.